Is it safer to stay in a hotel or family's home when visiting from out of state? And will the COVID-19 vaccine be something we have to get every year? WBZ's Dr. Mallika Marshall answers some of your coronavirus questions.
Charles says he's taking medications that put him at higher risk for infection and can't get live vaccines. He's wondering if the flu and COVID-19 vaccines are live vaccines. Charles, there are two main types of flu vaccine. There's the most common type, which is the flu shot, which is made from killed virus, and that is suitable for almost everyone to get. There's also a live virus version that's a nasal spray that isn't appropriate for everyone. As for a COVID vaccine, there are multiple varieties in development, and most of them are actually not live vaccines. Another question comes from Denise, who writes, once there is a proven vaccine for the coronavirus, would it be something you may need to take every year like the flu shot? Denise, we really don't know at this point. That's certainly possible. We do believe when you first get vaccinated against coronavirus that you might need a booster shot maybe a month later to try to get a better immune response, but we'll have more information once many of those clinical trials come to a conclusion. Mary writes on Facebook, would it be better to stay in a hotel or family's home when visiting another state? It's a large family with children in school. I am 76 years old. Mary, if by staying at your family home you'd be around people that you don't typically live with, even though they may be family members, it's probably safer to stay at a hotel. You just want to make sure that that hotel is taking precautions to keep guests separated from other guests and from staff members. Our last question comes from Cam, who says on Facebook that he was diagnosed with pneumonia 2 months ago. He tested negative for COVID. He still has a cough and wonders if he was misdiagnosed and really had COVID. Cam, pneumonia is an umbrella term that generally means inflammation of the lung, and pneumonia can cause a lingering cough. Pneumonia is often caused by bacteria or by viruses, including the coronavirus. Pneumonia is often diagnosed by a doctor listening to your lungs or obtaining a chest x-ray. It's possible that you had pneumonia caused by another germ, like another type of virus or bacteria, or that you in fact had COVID pneumonia, but you had a false negative test.
Dr. Mallika offers her best advice, but as always, consult your personal physician before making any decisions about your health. And if you have a question for Dr. Mallika, there are 3 ways here to reach her. Email drmallika@cbs.com, Twitter @Mallika Marshall, or Facebook message her, Dr. Mallika Marshall.